So now that you've started to learn just a little bit about craft, you're seeing that this is a counseling approach aimed to help the family and friends of people with a substance use disorder. Typically, this person might be the parent or the partner or spouse, but it doesn't have to be. The concerned significant other, as they're often referred to in the literature on craft, can be a sibling, a best friend, chosen family, anyone who may have an influence on the person with the substance use disorder and might be able to help them in a positive way. This approach was developed by Dr. Robert J. Myers at the University of New Mexico in the 90s, along with colleagues, and has been tested by research for over 30 years. When it comes to the typical advice that's given to anyone who loves someone with a substance use disorder, it tends to follow a pretty familiar script. They should use tough love, or let them hit rock bottom, or maybe they've been told that the way that they're trying to help shows that they are codependent. With craft, these are not very useful or necessary concepts, so we're going to start by clearing those out of the way. Craft was specifically developed to be an alternative to the dominant approaches that were already available. Dr. Myers and the other developers specifically wanted to design a counseling method that could be used to help the family members of people with a substance use disorder, particularly if their family member was refusing treatment. Craft was developed as an alternative to the way that family members are usually helped in this regard. Often people are told to do an intervention or to detach with love, as is recommended by Al Anon. Craft does neither of those things. Instead, Craft offers a series of skills, which can be delivered in as few as 8 sessions to the family, to help them to change their reactions to their loved one and use new skills in their interactions in order to help reduce distress in the family and increase the chance that their loved one does accept treatment help. Throughout this class, you'll get the beginning of an idea of how exactly it does that. An important part of helping the family in craft is to begin with a non-judgmental approach. What kind of judgments do you think families often face when they have a loved one experiencing addiction? Experiencing judgment can be a big barrier to seeking help. And in the spirit of doing no harm, we want to first make sure that we're not acting as a barrier for help seeking for families. We're going to learn a little bit more about the doing of craft, but just as important is that we're in the spirit of what craft is offering to people. This is a modern approach. It's meant to be respectful, hopeful, it's non-judgmental and non-confrontational, and it works on leveraging the power of relationship. When people come to us for help with a family member, we often meet people at a place where they're angry, they're exhausted, they're terrified. But by helping them learn new ways of interacting with their loved one, we can help people to learn to take better care of themselves and help their loved one at the same time. Now, families don't feel very influential, but they often do still have quite a bit of influence. In fact, research tells us that, especially for young adults, they frequently report that the reason that they sought treatment was primarily for family related reasons. Now, let's think about who could benefit from this approach. It's a lot of people. Substance use disorders are one of the most common mental health disorders, and at least 1 in 10 people in the United States have a substance use disorder. And the majority of those people who have a substance use disorder are not in treatment now and may never get treatment. This is called a treatment gap, and the treatment gap is particularly high amongst people who have a substance use disorder compared to other mental health disorders such as depression or anxiety. So that's a lot of people who could benefit from treatment but are not getting any. And for every one of those people, it's estimated that as many 5 additional loved ones are negatively affected by the substance use disorder. That's a lot of people. It's a lot of people who could use support. And a lot of those loved ones are not getting help for themselves, in part because the treatment system for substance use disorders is really designed for the individual and not the family. Because when there is support for the family, it's often only available when the person with the substance use disorder is willing to get help first. Also, stigma and judgment is a barrier for people seeking help. So in CRAFT, we're working with those family members, providing them the support that they need for themselves, while simultaneously helping them to build skills that can increase the chance that their loved one gets treatment. But to do so, we need people to be in relationship with one another. The good news is that people with substance use disorders are actually more likely, not less likely, to be in regular contact with their family of origin. Among adults with drug use disorders, between 60 to 80% either live with their parent or are talking to their parent almost every day. The chance that someone with a substance use disorder is living with one of their parents is 5 times the national average for their age group for people who don't have a substance use disorder. That's true in the United States and in other countries too. What that means for us is that our target audience, the loved one of someone with a substance use disorder, likely does have contact with the person with the substance use disorder, and that's good news for using CRAFT. When you're working with a family in a holistic or systemic way, it's helpful to think of the family like an ecosystem. Rather than seeing the forest just as a collection of individual trees, it's better to see the forest as a living system in which the health of the trees, the waterways, the animals all impact each other. You can't change one part of the system without it having a ripple effect to other parts of the system. In family systems theory, it would say that if one doesn't see themselves as part of a system, that they only think they have the option to change themselves or to withdraw a relationship when things don't feel good. But if you see yourself as part of a system, then a new option emerges. You might choose to stay in contact with others in the family and change yourself. And by changing yourself, you change the system. In CRAFT, we're seeking to change the system. Many times, families have been told that they do have an influence, but they may have only been told the ways that their influence might be negative. They might have been chastised for being enabling or codependent, but likely they've not been shown how to use their influence in a positive way. They may have been blamed for being too involved or blamed for not being involved enough, blamed for helping too much or blamed for not helping enough. How can you imagine that that might affect a family member's hope, their stress level, or even their willingness to reach out for help for their family? In this approach, not only are we going to avoid blaming families, but we're going to specifically teach them how to use that influence in a positive way by teaching them specific skills and helping them to practice those skills in real life. Stigmatizing and negative stereotypes can really dissuade family members from engaging with us, the treatment providers, and unfortunately also disregards ways in which family support can be very helpful in substance use disorder recovery. This article outlines a few of those big ideas, such as being actively involved in a loved one's treatment appointments, and CRAFT specifically has a treatment engagement procedure, or positively reinforcing a patient's choices, and CRAFT has a specific positive rewards procedure, or listening and validating to the patient's struggle to overcome addiction, and CRAFT has a specific positive communication procedure. So craft really helps take big ideas and turns them into concrete skills that can be taught and practiced. Before we move on, let's recap what we've covered so far. We know that millions of people have a substance use disorder in the United States. We know that most of those people are not getting any professional help. We know on average, although it may not be true for every person, they have frequent contact with family members. We know that families do influence treatment decisions, and that a lot of those families want support if they can find it in a non-judgmental, supportive way. That's our target audience. So now let's start talking a little bit more about what we actually do in craft. What is this? This is an approach that has simultaneous goals that we're working on at the same time. One goal is recovery for the person with the substance use disorder. We're looking for reduced or eliminated substance use and treatment engagement. At the same time, we have another goal, which is well-being for the family member, the concerned significant other, regardless of what the person with the substance use disorder does or doesn't do. We can get improvement in well-being for the family, even if the person with the substance use disorder still does not engage in treatment at this time. Any professional helper can learn craft and use it in their work. You might be here learning about craft as a therapist, or maybe an addiction counselor, or a peer navigator, a nurse, a group facilitator. All of you can use craft, but you might use it a little differently depending on your scope of practice and your license. Maybe you provide craft skills as part of a family program in a treatment center. Or maybe you facilitate a craft-based group providing all of the skills to families over 8, 9, or 10-week sessions. Maybe you provide individual therapy or family therapy, teaching all of the craft skills to a family and coaching them in the use of those skills. Maybe you have minimal contact with family members of people with substance use disorders because you primarily provide addiction treatment to the patient. But learning craft might help you to positively reinforce family member involvement or use the spirit of craft in your interactions with family members, even if it's brief. We can all find ways to use craft in our work, even if we have different roles. So you've heard me mention quite a few times now that craft is about teaching skills to the family. Let's look at what some of those skills are. One of the most important ones, I think, is the communication training. Craft teaches a specific positive communication model and really encourages role play practice and practice in real life. Not only is this one important because it really changes the way that families begin to communicate and interact differently, but the communication skills is also used again in some of the other skills of craft, so I often teach it pretty early with new clients because we're going to be using it a lot. There's also skills related to goal setting for self-care and relationship improvement. There's also quite a bit of work around behavior modification, and one of the ways to start that with families is to teach them to do behavior mapping. This is about teaching people that behavior makes sense, and the more that we understand what triggers a behavior and what reinforces a behavior, the more options we have about how to potentially influence behavior. Craft then teaches additional skills related to behavioral influence. How do we reward the behaviors we want from a family member? And how do we safely allow natural consequences? We also help families with problem solving, which is a great way to avoid advice giving while still being very helpful. And craft has a specific treatment engagement procedure, helping people to increase the chance that their ambivalent family member says yes to help. Now, you heard me say earlier that this was an evidence-based approach, which means that these methods have been tested in research settings and shown to be more effective than either doing nothing or doing a comparison approach. So let's take a look at what the research says. To help you understand what the research says about craft, I'm going to start by telling you about one of the early craft studies that was done in New Mexico in the 1990s. This was published in 1999. 130 concerned significant others of people with substance use disorders who were refusing treatment were recruited for the study. Once recruited for the study, they were placed in one of three treatment conditions. They were either offered Al-Anon facilitated counseling, or they were offered training in order to conduct an intervention, or they were offered craft-based counseling. The craft developer, Dr. Myers, supervised the craft counseling group by training graduate students to provide craft-based counseling. The concerned significant others in this craft condition were offered 12 one-hour counseling sessions in which they were taught all of the skills in craft and encouraged to practice those skills with their family member. In the Al-Anon facilitated therapy condition, the supervisor was someone who uses and believes in this approach, and that supervisor supervised the counselors who provided 12 one-hour sessions of Al-Anon facilitated counseling, in which the concerned significant others were encouraged to attend Al-Anon meetings and to accept powerlessness and emphasize detachment and self-care. In the Johnson Institute intervention condition, again, this group was also supervised by someone who believes in and uses this model in their work. Families were provided with an equal number of hours of support, but it was divvied up a little differently. Families were offered 6 sessions of 2 hours each, 4 sessions to prepare and train to do an intervention with their family member, 1 meeting to actually do the family confrontation, to do the intervention, and then a post-intervention evaluation meeting. Then the outcomes of those 3 groups were compared. In the craft condition, about 2 out of 3 participants, about 65%, saw that their loved one did start treatment before the end of the counseling period. Often this happened before the 12 sessions were even over. In fact, it took an average of about 6 sessions for that treatment condition to see their family member say yes and start treatment. In the intervention condition, about 25% saw their family member engage into treatment before the end. Partly this is because of a large drop-off in that condition. A lot of people who start the training to conduct an intervention with their loved one, for whatever reason, decide not to complete the intervention. Lastly, the Al-Anon group had pretty low outcomes as measured in treatment engagement. And I'd like to be fair to Al-Anon here. Al-Anon really isn't designed to teach you to get your loved one to change their behavior. And so it's not particularly good at that. Although I do think Al-Anon has other benefits of free and very available social support to people who often feel very isolated in this problem. But for treatment engagement, Al-Anon may not be the best condition. But as I said earlier, CRAFT has 2 main goals. One of them is treatment engagement for the person with the substance use disorder, but the other simultaneous goal is increased well-being for the concerned significant other. In these research studies, this is usually measured by measuring the depression score with the Beck Depression Inventory. And the good thing that we see in these CRAFT studies is that depression does go down over time, beginning first during the treatment condition and then continuing to go down even after the counseling is over. Another good thing about CRAFT is that the reduced depression for the CSO is not reliant on the outcome of their loved one entering treatment. We can still see reduced depression and other measures of improved well-being, even if their loved one does not get sober. Since the time of that 1999 study, there have been a lot of research studies about CRAFT. In 2020, there was a systematic review of many of those studies published, and there were a few things that stood out in the outcomes of all these studies over time. The more effective craft conditions tended to include a few key characteristics. One is an individual therapy modality for families, even if you're offering a craft-based group. Now, I love craft-based groups. It's how I first learned craft, actually, and I think craft-based groups are a wonderful thing to offer in the community and a really great way to make sure that families learn all of the skills, and often a more affordable or accessible way for people to do that. However, you will increase your improved outcomes for families if you still offer individual sessions to people who are participating in your groups. The other key characteristic is thorough training and supervision for the people who are offering craft. One of the studies with pretty poor outcomes had a treatment condition in which the people delivering craft to the family really had about half of the amount of training that they should have had in order to do that. So if you plan to offer craft-based services to people, I encourage you to complete a full training so that you can be the most effective. The third key characteristic, which we can't all do in our practice, but some of us can, is to offer integrated addiction treatment for the person with the addiction, often referred to as the IP, the identified patient. If you work in a setting where you can potentially provide craft-based support to the family members and then easily integrate the person with the addiction into treatment when they accept that they're ready for help, then you'll really get great outcomes. Let's summarize a little bit more of what the evidence tells us after 30 years of research. One thing we know now is that craft works across a variety of CSO to IP relationships. It works for spouses and partners, parents, siblings, friends. Although interestingly, mothers are very good at craft. If you were to take the data just for mothers out of these treatment studies and compare them to the data for everyone, you'll see that mothers get superior outcomes in craft. I guess moms just have a lot of influence. Another thing that we know is that craft works for drug use as well as alcohol use and even gambling. Another important thing to know is that the CSO can start to feel better even if their loved one does not enter treatment. Also, as I mentioned, craft works very well in groups, but you'll get the best outcomes if you still offer some individual coaching.